Hello, high schoolers. Thank you for giving me the chance to talk with you today and give a simple and easy to understand presentation about asthma. As you can see on my trifold, asthma is a chronic disease that makes it hard for air to move in and out of the lungs. Chronic means long-term, persistent, or continual. Asthma is the most common chronic condition affecting children under 18 years of age. The population is you guys. 6.2 million of children are estimated to be affected by asthma, and 3.1 million of it suffered from asthma episodes or flare-ups in 2015. Asthma is one of the leading causes of school absences. With asthma, the airways are inflamed. The muscles around the airways tighten, making the airways narrow. Asthma can be very life-threatening if it is not managed properly. So how does an attack happen? When a person has asthma, his lungs are extra sensitive to certain triggers or stimuli. Those triggers can be smoke, dust, pollen, mold, cockroaches, yikes, and it can also be through exposure to changes in weather, along with strong emotions when you're too happy, too sad, you're too excited, or too stressed. Sounds like high school, huh? It can also be brought about by food allergies. Once a person with asthma is exposed to those triggers, his airways become inflamed. There is inflammation of the trachea, that's your windpipe, down to the bronchioles, which are the smallest part of your airway. You can see from the picture how the airways are narrowed. Following the inflammation of the airways come airway muscle constriction. Your smooth muscles are tightened. There is swelling of the bronchial membranes, making the exchange of oxygen and carbon dioxide difficult. The hypersecretion of mucus, which in turn obstruct the airways, making breathing harder. These factors all contribute to the narrowing of the breathing passages and subsequently result in the presentation of the asthma symptoms, such as coughing, shortness of breath, chest tightness, and wheezing, which is a signature asthma characteristic. For the purpose of simplicity and easy understanding, we will assume that the patient has already been seen by a doctor, which means that thorough medical, physical, complete history, diagnostic, and lab works have been done and the patient indeed has asthma. Asthma medications do not cure asthma, but they help improve symptoms. Take medications exactly as your doctor has instructed you to. Right medication at the right time and right technique. There are reasons why an inhaler is called as such. First on the list will be the rescue drugs, also known as the quick relief drugs. These drugs are meant for short-term symptom relief. They are used to prevent or treat an asthma attack. They cause bronchodilation, which means that your tubes or your airways are dilated or open. These drugs begin to work within minutes and are effective up to 6 hours. Side effects include palpitations and jitters. An example of this drug is your Atrovent inhaler, pictured in the trifold. Long-term control agents, also called maintenance, controller, anti-inflammatory medicines, are drugs used to prevent attacks and control persistent asthma symptoms. These drugs include inhaled corticosteroids, they are steroid hormones, long-acting beta-agonists, theophylline, and combination inhalers that contain steroids and the long-acting beta-agonist, also known as LABA. These drugs usually take days to weeks to reach full effect. They prevent symptoms for up to 24 hours. Side effects include headache, tremors, stuffy nose, and stomach problems. Please keep in mind that these medications require prescription. Some medications react to other types of drugs. It is imperative that your doctor knows all the medications you are taking. In order to prevent asthma attacks, it is recommended to have an asthma action plan. It is an individualized plan that lists the steps to manage asthma and prevent it from getting worse. Part of the action plan is recognizing your asthma zones. They are red, yellow, and green, which translates to danger, be cautious, and under control. Green is where you want to be on daily. You feel good. You have no symptoms. Continue to take long-term control medications and have your rescue meds ready. Yellow means you are experiencing some symptoms. Slow down. Follow the steps in your asthma action plan, including the use of quick relief meds to prevent asthma from getting worse. Red means you are under a severe asthma attack. Follow the plan. Get immediate treatment if symptoms do not improve. There is another important factor to help monitor asthma. This is called the peak flow rate. This is usually recommended if you have moderate to severe asthma. This peak flow rate is measured using a peak flow meter and can show if your asthma is getting worse. This is also used to determine your asthma action plan zones after monitoring and knowing your highest peak flow number in a 2 to 3 week period. Tracking your symptoms is another way to monitor if your asthma is under control. It is always important to keep a diary, write down your zones, triggers, and symptoms. I have listed some preventive measures for asthma in the trifold. The gist of it is mainly avoiding your triggers, being informed and aware, taking your medications correctly, and overall living a healthy lifestyle. If you need more information about asthma and wants to dig deeper into the medications, pathophysiology that includes all those exciting T cells, immunoglobulins, and other fancy scientific terms, you can refer to the following sources, or you can also email me at crexl95@yahoo.com, and I would gladly help you understand asthma more. Thank you for your time and attention.